Good, happy Tuesday morning, April 21, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Tuesday morning, so let's begin. First up, another COVID-19 death announced as 56 new cases confirmed in New Hampshire. Health officials say community transmission of the virus continues. One more person has died of COVID-19 in New Hampshire as health officials announced Monday that 56 new cases of the illness has been diagnosed in the state. Health officials said the victim was a woman older than 60 who lived in Rockingham County. There have been 42 people who have died of COVID-19 in New Hampshire, health officials said. A total of 1,447 cases have been diagnosed and 884 cases are still active. 3 more patients have been hospitalized in the state, and health officials said 78 people are currently hospitalized. Health officials said there continue to be evidence of community transmission of the virus in the state, and they urge people to continue social distancing practices and taking other precautions to prevent the spread of the virus. And now let's take a look at your COVID-19 information, what you need to know. And here's a look at that COVID-19 information, what you need to know. There are 1,447 number of people in New Hampshire who have tested positive for COVID-19. There are 782,159 number of people in the United States who have tested positive. 42 number of deaths from COVID-19 in New Hampshire. 201 number of people who have been hospitalized with COVID-19 in New Hampshire. And 41,816 number of deaths from COVID-19 in the United States. This map of New Hampshire shows you where the cases of COVID-19 are in towns and cities of New Hampshire. Nashua, 135 cases of COVID-19. In this chart here, new cases each day in New Hampshire. In the purple, daily new positive COVID-19 cases. In the orange, new hospitalizations. And in the red are the deaths. Common symptoms: fever, lack of smell, cough, and difficult breathing. How it spreads, and prevention tips. Be sure to stay with the Riley King Network for the latest of COVID-19 information. New Hampshire health investigators continue to trace contacts of COVID-19 patients. Officials try to track down the path of infection. Let's take a listen to that video from WMUR News 9, Amy Cavino.
first hear of a confirmed case, we'll often talk to the healthcare provider first to collect some clinical information about that individual, what their symptoms were, when they became ill.
The next call is to the patient to verify the clinical information. Then the trace begins.
We find out when they became ill, and we look at that 48-hour window period before their symptoms developed. And we interview them and ask them about all the things that they did. Where did they go? Did they go to work? Did they have dinner with anyone?
In the beginning, the contact list might have had 100 people. In the age of social distancing,
we are identifying fewer and fewer close contacts. And this is a direct result of these measures that have been put in place from a policy perspective.
In March, 50 to 60 investigators were added. They were trained before the surge of patients. And the state's two largest cities have their own public health departments.
They are fully capable of performing these investigations for their residents and their communities. And they work very closely in partnership with us using the same protocols and training that we use.
The investigations all done over the phone. So how can you trust the person who is calling is really from the state?
There is a process that we use for people to verify our identities. First of all, we have state-issued emails. We're often calling from state phone numbers.
People are actually encouraged to ask for verifications. Officials say that there are methods to ensure that the caller is legit. They just don't want to reveal them. They say that their callers on the other end will not be offended. They understand that scammers are out there. We're live in Manchester this evening. Amy Cavino, WMUR News 9.
Okay, and there you go on that video and that report. Hundreds of boxes of food being distributed in Chelsea, Massachusetts. Let's take a listen to that video from WCVB, Sarah Conji.
I wanna go, where my baby's here.
You must be Steven's phone.
Know who's on your network and control who shouldn't be with Xfinity X5. Simple, easy, awesome.
Antoinette, this community has been hit especially hard by the pandemic, and the tents that you see behind me is part of the latest effort to help those who are unemployed and struggling to put food on the table. Hundreds of boxes are being prepared. The city of Chelsea has mobilized to help out, along with a team of volunteers. They've been packing up food since last week, and each box contains meals for a week for 2 people. The goal is to distribute 500 boxes each day to patients, especially those in isolation.
This is a really crucial effort. So before we had the COVID-19 pandemic, a survey from the Chelsea Hunger Network revealed that over 60% of households reported running out of food in the last month. This crisis has only exacerbated food insecurity in Chelsea.
The National Guard is already on the ground here in Chelsea, helping to distribute meals that have been provided by the Salvation Army and NEMA. Testing has also been ramped up with 2 drive-through sites opening last week, and also hotel rooms are available to help separate those patients and isolate them who have tested positive.
Okay, and there you go on that video and that report. One new coronavirus-related death, 8 new cases reported in Maine. Let's take a listen to that video from WMTW News 8 Maine.
My broken heart.
I got to hold him for about 5 minutes.
Good afternoon, I'm Steve Botari with this breaking news update. We're getting an update now from the Maine CDC on where our state stands when it comes to the coronavirus outbreak. Let's go live now to Augusta.
On the COVID-19 situation across the state. Unfortunately, we again begin today's briefing on a sad note. Maine CDC is reporting an additional death, the passing of a woman in her 70s from Waldo County. The This unfortunately marks the 35th death of a Maine person with COVID-19, on a day in which overall in the United States there have been over 40,000 deaths. We at Maine CDC offer our condolences to the family of this woman during this time of their grieving. In addition, Maine CDC is reporting now 875 total cases of COVID-19, an increase of 8 since yesterday. As of this morning, there have been no additional cases recorded at long-term care facilities since yesterday.
Okay, if you want to hear the rest of that press briefing, you can see it after the broadcast. We will share this link with you after this broadcast. The Maine Center for Disease Control and Prevention reported one new coronavirus-related death on Monday. A total of 35 Mainers now died of the virus. The new death reported on Monday was a woman in her 70s in Waldo County. The Maine CDC website reported that confirmed cases rose to 875, an increase of 8 cases from Sunday. It is the smallest daily increase in cases in about a month. Dow features point to opening drop of 400 points. Stock features pointed to losses in early morning trading Tuesday as oil prices remained under pressure following an unprecedented wipeout a day earlier. U.S. monitoring intelligence that North Korea leader is in grave danger after surgery. Let's take a listen to that video from CNN.
Okay, so here's our breaking news tonight. It is out of North Korea, and it's a serious question about the health of Kim Jong Un following recent surgery. This is what a source is calling the concerns of credible, but saying that the severity is hard to assess. Since Jim Sciutto is here with more, I know that is a bit complicated, but Jim Sciutto is going to explain all of it to us as much as he can right now. Jim, I'm so glad that you are here. You would know about all this. Talk to me about your reporting. Break it down for us. What are you learning?
So Don, a U.S. official with direct knowledge tells me that the U.S. is now monitoring intelligence that the health of the North Korean leader Kim Jong Un is in grave danger. This is following a surgery in recent days. We should note that 5 days ago, Kim was notably absent from a ceremony honoring his grandfather, Kim Il-sung. This is the kind of public ceremony like the one you're seeing here on the screen that Kim Jong Un traditionally takes part in. He was absent from that ceremony 5 days ago. It was 4 days before when he was last seen in public at a Politburo meeting. So during those intervening days, there were questions. Why is he absent? And it's more recently that the U.S. has been monitoring intelligence that he had a surgery, that the aftermath of that surgery, there were complications, and his health is now in grave danger. Don, I should note that with any intelligence issue regarding North Korea, that North Korea is the blackest of black boxes when it comes to intelligence for the U.S., a difficult box to penetrate. So when discussing intelligence about North Korea, you always have to keep that in mind. But again, you really have a combination of indicators here now. The intelligence about this surgery, the complications following it, but also his absence from that event a number of days ago.
Okay, so you said the blackest of black boxes, meaning very tough to get information out, and accurate information, not transparent, no transparency at all, or very little. So then, do we know what would happen next, Jim? Do you know that?
Well, here's the thing about North Korea. It's very top-heavy government. He's a dictator of a hermit state here. And we should note as well that Kim has taken great pains in recent years to eliminate any potential competitors for power, including taking the alarming step of assassinating his half-brother, Kim Jong-nam, in Kuala Lumpur Airport. this is a couple of years ago, using a nerve agent. There are other senior North Korean officials who he eliminated via assassination. So that leaves gaping holes if, and this is a notably large if, of course, Don, if he were not to survive this. There is his sister, who's in a very powerful position there, other senior officials, but it raises enormous questions. And we can report as well that the U.S., as these questions has been raised, have reached out to North Korean experts, including on the peninsula, to ask about contingency planning. You start to think about questions about what do you do if there's an outflux of refugees? Is there a need for humanitarian assistance? Again, these are questions you begin to ask and prepare for if worse events follow what we know at this point. But we should also note as well, North Korea is a prime national security threat to the U.S., so any instability there is one that the U.S. watches very closely. It's a nuclear power. It has missile capability of striking U.S. targets, so the national security implications for the U.S. are enormous as well.
Okay, and there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your morning, and I'll see you back here later on today for another newscast. And I'll have a news report coming up in a little bit. Goodbye.